Okay, great. So next on, we're going to move on to Dr. Elsa Glanville. Elsa will be speaking with us today about infectious abortion in ewes. Elsa wears a few different hats. She's a livestock veterinarian who's passionate about sheep reproduction. She also currently works part-time as a vet consultant with Wellstock and part-time with the New South Wales DPI Animal Biosecurity Unit, and also co-manages a merino enterprise in the Central Tablelands. So because she has so much free time, she's been able to come across here today. So really, thank you, Elsa.
As Keely said, I'm quite passionate about infectious abortion in sheep, so I'll try and keep to time, but yes, we'll do our best. So, bit of an agenda. We're going to run through some terminology. Different words are used by different people to describe loss at different stages of gestation, so I thought it might be a good place to start. Then we'll talk about what we might see at different stages of pregnancy before moving on to how to go about investigating abortions, and then some commonly diagnosed infectious causes. So, I don't know my slides off by heart, so I'm going to turn slightly so I can read them a little bit. When I talk about reproductive performance, and hopefully we're all on the same page here, I think about the whole kind of gamut. So I think about the number of lambs weaned per ewe joined per year, and obviously there are a whole heap of factors that can go into influencing that, but it comes down to three main things, I think: the fertility, fecundity, and then loss that occurs at any point from joining right through to weaning. When we're talking about pregnancy loss, it might be loss of the embryo, and that's really from 13 to 34 days gestation, so quite early on. If you've got a 5-week joining, by the time you pull the rams out, the oldest gestating pregnancy will be just kicking over from an embryo into a fetus. That's important because it affects what you might see as a symptom of loss. The fetus is typically defined as anywhere from 35 to 150 days or full term. And that's what we typically or technically define as an abortion. So pregnancy loss after organogenesis, after that embryo kicks into that fetal stage. That fetal loss might be resorbed if it's really early on, in which case you'll see very little. It might mummify, or it might be passed as an obvious fetus that's seen, and plus or minus membranes that might be seen. Then obviously as the gestation completes and the fetus comes to term, if it's born deceased, then it's termed a stillbirth, or if it dies within that early stage, it's neonatal mortality. I won't be talking about any of those classic causes of neonatal mortality today, except for the fact that some of those agents that cause infectious abortion, as we well know, are also very adept at causing stillbirth and neonatal mortality. So something that affects the ewe to cause abortion might also present with stillbirth and neonatal mortality. So I'm not going to talk through this slide today. It's here as a reference tool, I guess. I put it together so that you as consultants can hopefully, if you're faced with clients that have reproductive questions during pregnancy for sheep, you can use this as a tool to sort of go, okay, what stage are we looking at? Okay, we're at scanning. That if it's sitting at 80 to 90 days, then we're talking about fetuses. Often there are very little external signs for those ewes. Whilst we've got some measures, for example, a non-viable fetus rate that a scanner might pick up, there is very little that you often see externally. Importantly, we often have an unknown cause for these kind of losses that occur that are picked up at scanning. But yes, I've put this together as a reference tool, hopefully, and if you get a PDF of the slides, you'll be able to have a look through it. Not moving. There we go. So just a bit about early embryonic loss. This is where some or all of your embryos, the embryos resorb. If that occurs, it might be a partial, which is where some of the embryos resorb, or complete, where all of them resorb. It's really, really hard to detect, often, especially if we're not scanning. And often what we might see is a really protracted lambing or more ewes that return because more ewes have returned to service. We might see a higher than normal rate of empty ewes or absolutely nothing. Definitive diagnosis of these kind of losses is really, really difficult. Often it's retrospective, so we're looking back historically well after the horse is bolted. Or even in cases where it is picked up early on and we throw everything at it to try and diagnose a cause, often we don't find an infectious agent and we can't actually pin a diagnosis. Some of the infectious causes that can play havoc in this early embryonic stages are toxoplasma and pestivirus, but as I said, they're very hard to pick up. So one of the reasons I think that scanning is a useful tool, in addition to obviously its ability to pick up how many fetuses we're expecting, is the fact that if we've got experienced scanners, we have an opportunity to pick up early losses. So at scanning, if you've got a 5-week joining and our scanner's coming at about 90 days, then our fetuses are going to be 55 to 90 days of age. And that means they're, in real terms, they're from about this big, about 13 centimetres long, to about this big, 20 centimetres long, and this big one at 55 days, that is the skeleton's mineralised, that's what the scanner's picking up on, and it's about 60 grams, and this big one is about 600 grams. So it just gives you an idea of what you're actually playing with, which is relevant in a second. So you'll pick up fetuses that, or ewes that didn't conceive or experience early loss, unviable pregnancies, or happily pregnant ewes. Obviously that gives you no prediction of what's going to happen later on, but it gives you an indication of what ewes you're managing. It gives you the first chance to check reproductive performance and the opportunity to investigate if you're concerned. So if there are higher than normal losses or unviable pregnancies or a higher than normal empty rate, then that's a point where I think you should be advising producers to tick over into investigating, and that's usually through making contact with the vet and initiating that investigation process. Something that people often ask about is, so I've scanned up this number, I've got this number, there's a big discrepancy there. Is it possible, I haven't seen anything unusual, is it possible that all those fetuses that were scanned up at scanning just resorbed? Could they just disappear? And there's not a whole heap of really concrete info out there, but I think if you think about what we talked about before about the size of that fetus and how well mineralised it is by that time. So this is a picture of, it's quite an old picture, but it's a picture of the degree of mineralisation of the skeleton. So this is a little 38-day fetus. It's just ticked over from an embryo to a fetus. It's got a cartilage precursor of the bones. Those forelimb bones are starting to mineralise, so that's the black, and some of the skull bones are starting to mineralise. It's quite small. It's about, I think it's about 7 centimetres at that stage. That can totally, absolutely resorb. By the time you get into a 43-day fetus to a 49-day fetus, you've got a much more mineralised skeleton. It's a much more substantial entity, and you're far more likely to see something as a result of an abortion that occurs at that stage. So they're less likely to just disappear into thin air. And as that gestation progresses, we're more likely to see clinical signs externally in that ewe. So what we see in mid to late term abortions, so from scanning onwards, is this breech stain. You might have clients reporting that they're finding placenta or membranes. You shouldn't be seeing any of this before lambing start date. They might be nice fresh membranes like those ones, the pink ones. They're quite edematous. That was a case of Campylobacter abortion. Or you might have clients send you a picture like that one on the right of some dried membranes in the yards just after pre-lambing treatments. You might have reports of this charming photograph I was sent of a midterm fetus that was found. This little guy down here is an early late term, so that's about 4 to 5 weeks before lambing start date. You can see he doesn't have much wool development. His eyelids are fused, compared to this guy that's just almost on the point of lambing. So there's obviously different developmental stages here. They're all things that we shouldn't be seeing before lambing start date. Or you might have the real goodie bag of this one here, which is a bit gory, but that's a mummified fetus sitting next to an almost full-time fetus still in its membranes. So they're all signs that something is not quite how it should be. As we mentioned earlier, infectious abortogens also cause havoc with the survival of the neonate, and it can result in stillbirth. So this is a picture of a stillborn little lamb, never walked, obviously, never breathed. This little guy down here was a neonate that died as a result of an Campylobacter infection. So he did walk and he did breathe, but he was incredibly weak and succumbed. You might have preterm lambs. So that little lamb in the middle is a premature lamb. It's got very flexed tendons, can't stand properly, very floppy ears, and was very small relative to the rest of the mob. Or you might have congenital malformations. So if you've got clients with issues or they're suspicious of loss, like they're seeing ewes with discharge prior to lambing start date, any of those kind of fetuses that I've just shown you, or neonatal mortality that you're suspicious of, then I think it's really warranted to link up with the vet and kickstart an abortion investigation. Whilst some level of abortion is quoted as being normal, and so we say sort of 1% to 2% abortions might be normal, the issue is, I think, you don't know if that 1 or 2 abortions that you're seeing might end up being a 50% abortion rate as a result of an infectious agent. So if you get in there and advise your clients to sample and submit that sample, then you might be able to actually implement some treatment before it gets to a point where it's too late. So in a retrospective study looking at across 500 plus abortion investigations across 4 states, Tom and the team over at Murdoch and a big collaborative project found that a diagnosis was able to be made in 57% of the abortions that were investigated. I think that's a really important point to communicate to our clients, because it's not that the investigative process is failing us, it's that it's actually quite hard to pin a diagnosis for abortions, and sometimes it's not an infectious agent. So in the cases that we did find in the cases that we did make a clear diagnosis, only 80% of those were infectious. There were other agents at play as well, non-infectious agents. So of those diagnoses that were infectious, our major causes were Campylobacter, Listeria, and Toxoplasma, which we'll touch on in a second. So before I go into those agents, a brief overview of, from a consultant perspective, how you can approach an abortion investigation. The first thing is make contact with a vet. If there are 2 or more abortions, I think that's a relatively okay threshold to sit at in one mob at the same time, or if you're highly suspicious of there being an infectious cause. So if you've got some of the risk factors at play and you've found a fetus, bag that fetus up and send him off. Let your clients know that a lot of the infectious agents that we deal with are zoonotic. So they're capable of causing disease in humans as well, and they're most capable of causing disease in humans if that human happens to be pregnant or immunosuppressed. So I think that's a really important thing that we need to be actively communicating to clients. So wearing gloves at a bare minimum, disinfecting afterwards, and washing the clothes that they've handled that abortus or the aborting sheep in separately to other clothes is a really strong message that we can send out. In terms of sampling, when we talk about neonatal mortality, often we talk about, post-morteming, educating our clients about how we can do lamb post-mortems. Totally different messaging for where you're suspicious of infectious causes or where there's fetus or membranes found. Don't open it up, just pop it all in a Ziploc bag, pop that in another bag, and then I'm maybe a bit overly cautious, put it in a third bag. It's not going to hurt. Just triple bag it, label it really clearly. So here we've got, where's my thing? So here we've got, it's labelled. I've said it's got 2 fetuses in there. It's from farm A, the paddock, the date, and a phone number. And I'd also put a contact name on there as well. And then refrigerate it, preferably. Definitely not in a food fridge. So if you can remove or mark the ewes that have aborted, practically speaking, that can be really difficult. But if you can advise that, then do. And then practice good biosecurity between mobs, because these agents, especially Campylobacter, is very able to be transmitted on fomites between mobs. So a bit about our agents. Campylobacter, there are 2 species, Fetus fetus and jejuni. It's a bacteria that's ingested from a contaminated environment that then goes on to cause reproductive loss in a naive ewe. It's either shed by carrier ewes in their faeces or by ewes that have been freshly infected, have aborted, and then are shedding it in their discharge for up to 6 weeks. And that can hang around in the environment for a month plus, especially if it's cool and moist. So perfect environments for Campy to just sit there on the pasture ready to contaminate another naive ewe. So we tend to see abortions 3 weeks after infection. It can be much less, it can be much longer, depending upon the immunocompetence of the ewe and the bacterial load that she ingests. And what starts with a few can end up in a storm. And there are certainly reports out there where up to 50% of a mob can abort. And that's just a catastrophic loss for a producer, and it's a really stressful process to go through. So that's why I say, get in early and try and make a diagnosis. I'm not going to go through this now, but I didn't know there were so many animations in it. Look at that. I've included that in the references, in the slides as a reference for you if you want to go and have a look at it later. Just really emphasises the fact that that environment is contaminated for weeks. It takes time for a ewe, once she's been infected, to abort, but then they go on to shed it for a month and a half. So important points in the etiopathogenesis of the disease. Important risk factors. So both these environments here, this beautiful lush green paddock up near Yea and this containment drought lot in the Central Tablelands, are both environments of relatively high risk for campylobacteriosis. The top right one at Yea, because that's an endemic property and a naive mob was brought in, not vaccinated, exposed, and then there was a Campylobacter outbreak. The drought lot, because there's obviously high levels of fecal oral cycling. In that case, there'd just been some drought-breaking rains, perfect to create little situations where Campylobacter can just hang out and expose naive ewes. Other risk factors, so that trail and containment feeding, like I mentioned, lots of fecal oral cycling, stressed ewes, mid to late pregnancy. Young ewes are at higher risk because they're less likely to have seen Campylobacter before and they're less likely to be immune. However, I have certainly seen it in outbreaks in older ewes where their immunity's been overwhelmed by a massive challenge. So don't rule it out as a cause of abortion in older ewes. Our treatment and response options, there are certainly antibiotics that are active against Campylobacter, and there is also evidence that vaccination really early in an outbreak can cut off or reduce the consequence. However, often we're dealing with late pregnant ewes, and so you've got to weigh up the challenge of handling those ewes and the risks associated with handling those ewes with the risks of the consequence of the abortion. And I think that's where hooking in with a vet who's experienced and has previous kind of knowledge about what the best course of action in different scenarios is really important for this particular, for abortogens in general, I think, in sheep, because they don't tend to read textbooks. Actions that you can advise are removing birth products and or the aborted ewe from the paddock. That sounds like a really great idea. In principle, if you've got nice little square paddocks or rectangular paddocks, maybe it's possible. Our place, we're sitting at sort of 150, 200 hectare paddocks, and that's just not a thing that's able to be done. So it's really important to understand that there are some pieces of advice we can give out, but it's not always feasible. Prevention-wise, immunity prevention is always better than a cure. The vaccine does a fantastic job at inducing immunity, 2 doses more than 3 weeks apart before or at joining, and then an annual booster depending upon the situation. Natural immunity can work in some situations, can also be overwhelmed by a massive challenge. So we don't have time to go into depth about that now, but yep, they're your 2 options. And then risk management. So talking that containment lambing and late pregnancy containment feeding ewes, that's one of those big risk factors, just being aware that there is a risk of campylobacteriosis in that environment, so managing accordingly. Listeria, Ivanovii and monocytogenes are the 2 species that we deal with. It's a ubiquitous environmental bacteria, and that environmental population of bacteria is topped up very regularly by shedding carrier animals. So that might be sheep that are shedding the organism, or it might be birds shedding the organism, or any other mammals that are carriers that are contributing to that environmental kind of load. Naive sheep come along, and especially if they happen to be in late pregnancy, they're very susceptible to reproductive loss as a result. So we tend to see abortions in Listeria outbreaks about 10 days after exposure, although that can be anywhere from as short as 5 days up to 2 weeks. It tends to be in the last month of gestation, and so we sort of see these kind of fetuses like that little guy up there, and when you open them up and a vet opens them up or a pathologist opens them up, we see them riddled with these tiny little abscesses. So the ewe is usually okay in Listeria cases. Listeria also causes a neurological condition in sheep, as well as a septicemia or blood poisoning. We often don't see abortion and the neurological condition sitting side by side, although there are cases where it has occurred. And the reason why we see it in that last month of gestation is because the ewe's immunocompetence really decreases. Again, I've included this, I'm not going to talk through it, but it's for reference. It emphasises the point that carriers are a really important contributor to Listeria outbreaks. So other risk factors include cold, wet weather. The western or central west of New South Wales, central tablelands at the moment, is a beautiful environment for Listeria. We've got standing water everywhere, rotting vegetation everywhere. It's a perfect environment for Listeria to grow. Poor quality silage and hay is the classic kind of abortion listeriosis risk that's quoted. I've never seen a case of silage-induced Listeria abortion, probably because we don't have a lot of silage feeding, or the silage that is fed is pretty well prepared. But certainly internationally, that's the major risk. Improperly prepared hay or loose bales or soil contaminated bales are also a risk, and I have seen a case of that. Big temperature swings, very importantly, stresses, because that, like for Campylobacter, big stresses late pregnancy kick off shedding by those carrier animals, and that then poses a risk for other naive animals in the mob. So response to listeria, we're again looking at hooking in with a vet for antibiotics. If you can get in early, you can certainly really change the outcome of an abortion storm with treatment. Actions, again, similar for campylobacteriosis, changing paddocks to minimise further exposure. If you can, sometimes all the paddocks are wet and everything's got rotting vegetation, so you've kind of just got to sit and wait. Again, why abortion outbreaks can be really stressful. Control and prevention, obviously taking care with feed selection, not feeding improperly prepared silage to late pregnant or mid-pregnant ewes. General ewe health, that hooks into the immunocompetence, so just making sure, ewes are fed according to their requirements, all those really basic principles, makes them more robust. That's all well and good, but there are certainly cases of outbreaks where ewes have been looked after as perfectly as they can be, and then the challenge is just overwhelming. And then feed strategies for high-risk ewes. So that comes in when you've got, if you've got a producer that's scanned for triplets, for example, they've managed those triplets separately, or lighter multiple bearing ewes, and they're trying to supplementary feed them. Perhaps not supplementary feeding them on the ground, but just using like some little, whatever strategy they've got, if they've got any kind of feed strategy that's off the ground. This is a mob of particularly poor doing triplet bearing ewes, and they're just being fed in a little, semi-trough. And, if that's something you can do that's a mob of sort of 60 ewes that are being fed like that, and it just gets them out of trouble off the wet ground, out of a fecal oral cycling. Toxo I won't talk about in too much depth, except to say that it is a protozoa carried by cats, shed in faeces, and those oocysts shed by cats hang out in the environment for months to years. So if you've got a producer that's had an abortion outbreak as a result of toxoplasma, the environment that you suspect was the source is likely to remain as a source for the next lambing as well. So just being aware of that in terms of managing which ewes are exposed to that environment is a handy piece of advice I can pass on. So toxoplasma, different to Listeria and Campylobacter, it can cause reproductive loss throughout gestation, except for, say, the last ewes that are exposed in really late pregnancy tend to give birth to lambs that are infected but are often normal, but it can cause loss right from the get-go through to mid to late gestation. There are fewer pharmaceutical options that we have available to us as vets to treat toxoplasma, and by the time we're detecting it, often the damage is done. So it's another one of those sit and wait and see how extensive the outbreak is going to be. Prevention-wise, there are, often the literature says, or the textbooks say, rodent and cat control are really important strategies. I've had toxoplasma outbreaks on properties where there's no known source, so no active cat populations. They're not feeding hay from, a barn shed that has cats all over it. No rodents. So I think it's a difficult one, to sort of discuss with clients, because often there's no clear-cut prevention strategy that we can recommend. And indeed, toxoplasma across Victoria, there's actually a fairly low level of exposure across our ewe flock. So there are a couple of farms that have really high levels of exposure, but then the bulk of ewes across Victoria that we've done serosurveillance studies on don't have very low exposure. So that to me suggests that there's actually relatively, that the opportunity for exposure is low in the environment in general, but when it does happen to occur and a mob of pregnant ewes are exposed, the consequence can be quite devastating. So it's hard to predict, is what I'm trying to say. So I've included a life cycle as well. We have other infectious agents. Some of the agents that cause bacterial enteritis also cause abortion, Salmonella and Yersinia. This was a case, that little pictures from a case of Yersinia enteritis in weaners, and we then started to see Yersinia abortions in maiden and mature ewes in adjacent paddocks. And that was all through the combination of risk factors like short feed, recently off shears, wet weather, changing feed, so shifting from supplementary feed to a paddock feed. So that combination just resulted in kind of a Yersinia outbreak that affected the weaners and the mature ewes differently. We've got some exotic agents like Chlamydia abortus and Brucella melitensis, which we're very fortunate not to have here. But one of the reasons we are very pro-investigating these agents is as rule-outs for those. So often there'll be state veterinary department support for abortion investigations, which is worthwhile knowing, because one of the, decreases the cost to the producer if we can assist with that. And then there are non-infectious causes as well. So before I wrap up, as a general abortion response, again, this is more of a sort of reference slide, but ideally we'd like the outcome in an abortion storm to be, we minimise the total abortions, we maximise lamb survival, we reduce the future occurrence, and we support a producer through it. And the ways in which we can do that are through stopping more ewes being exposed, by getting in there and treating early if we can, by addressing the consequences of that infection for the neonates that are being born. Risk mitigation, that comes down to, maybe it might be vaccination, it might be reducing fecal oral cycling, whatever the risk factors are, but it's going to be disease and outbreak specific. And then in terms of supporting producers, I think facilitating knowledge transfer so they understand what's going on, they understand the risk to themselves potentially, and they also feel like they've got someone to talk to, because often my experience has been, sometimes it's a matter of sitting and waiting and just seeing how extensive this is going to be, especially if it's very late pregnancy and you can't possibly get ewes in, or it's going to be a much bigger, there are going to be much bigger risks associated with getting them in. And working together with a vet sort of underpins all of this, so hopefully that encourages more vet consultant collaboration. And yeah, my take homes: work with a vet, be aware that only around 50% of our cases reach a diagnosis, but that can really influence our treatment options. And that often we need bespoke management because these agents don't tend to read textbooks and every farm's different, which you'd all understand. There is a zoonotic risk and they're often stressful and the outcome's uncertain. So be there to support your producers, and yeah, that's it for me. Maybe.
Questions?
Elsa, what percentage do you think could be fairly attributed to scanning error, assuming everything's done on time?
So from what I've read, and from the scanners I've worked with, if you're scanning at the right time, so scanning at 80 to 90 days, ideally 85 days, then an experienced scanner has a very low error rate. So I think there's an accuracy of, depends on the paper you read, but 98% plus. Would you agree with that, Andrew? For experienced scanners, sitting at sort of 98%.
The word experience is a bit misleading, because there's
Yeah, true.
guys that we know just repeatedly do a bad job. I think it's
So experienced, accurate scanners, There we go. So when I'm saying experienced, I'm talking about experienced scanners who scan repeatedly and accurately. I'm very fortunate in our area. We have a few scanners who are very, very good, but certainly have worked on places where there's been a perceived reproductive loss, and there hasn't, I don't think, been one. So yeah, certainly. And often that comes through word of mouth as well, doesn't it? So yeah, I think.
Any other questions?
Thanks, Elsa. I wondered if you could touch a bit more on some of those late pregnancy management practices that might stress ewes and bring on abortion, and yeah, I guess how to mitigate against that.
Yeah, that's a really good question. It's easy to say reduce stresses, isn't it? So my feelings are it is going that is enterprise specific, and that comes down to when I'm talking to a producer in that situation, I get a history of what's going on and what kind of, whether ewes have been trucked in late pregnancy, for example, or shorn in very late pregnancy. They can be both situations where, they've been shorn, they've been held off feed, and in that time, ewes have started shedding. A ewe has started shedding bacteria, for example, and then other ewes have had the opportunity to ingest that bacteria because they've been held in close, in holding yards, for example. So I think it's not just that action of being trucked or transported. It's also the fact that they've been held in close contact during that time that's given the opportunity for exposure. And in saying something like reduce stresses, I think we have to realise that there's, it's a balance between reducing the stressor and ensuring that the other practices that need to occur, for example, pre-lambing treatments, drenching or vaccinating, they have to occur too. So maybe it's making sure ewes aren't held in close contact for a really long time, or they're not held in, what was one situation I had was where they were brought into yards, they were held in yards that had previously been, so they'd previously had spread, what was it? It was hay that had kind of broken up bales that they'd had, and that was the suspected source of listeria, and they'd just been in there with that as a feed source. So it wasn't the fact that they were put through the yards for vaccination, it was the fact that they were held in that environment for 24 hours beforehand. So it's just being aware that those risks exist and then doing what we can. So maybe in that case, bringing them in the morning that they were going to be yarded, or immediately the night before, and getting them through the yards, not trying to hold them on feed for that time. Yeah. So that's case specific, I think.
Elsa, do you think it's worth screening, for producers buying in replacement ewes, do you think it's worth screening them for camping?
That's such a good question. If you're going to, I think it's worth working with a vet who understands calculating sample size so that you can figure out how many ewes you need to bleed to detect the presence of disease or the absence of disease. And it's also about knowing the status of the property you're bringing them into. So if you know you've got a property that's got cycling Campylobacter, I haven't done basic numbers on it, but my gut feeling would be it would probably be less expensive to vaccinate the ewes that are being brought in against it, rather than running the number of tests you'd need to run with the sensitivity of the test we have to figure out whether they'd been exposed. And like, as you'd know, that test, the test that we have at the moment is imprecise, and it's about how recently they've been exposed. So those ewes could be carriers that you're bringing on. They could be carriers, but they may not be antibody positive. and we don't quite understand that relationship perfectly yet. So I think if you've got a situation where you'd consider it high risk, vaccination is going to be, you know, an important consideration rather than relying on a potentially imperfect screen, unless you're going to bleed every single one and bleed them at multiple time points, I think. Yeah.
Okay, was there any final questions? No? Okay, fantastic. Thank you so much.
Thanks.